Today I am going to discuss with you a very common hair loss. This hair loss is called as alopecia areata. Many patients come to me in my outpatient clinic regarding alopecia areata. What is alopecia areata? Alopecia areata is a hair loss on the scalp. It can occur on the beard side, on the mustache side also. The alopecia areata lesions can be single or it can be multiple on the scalp. If there is hair loss in the entire skull region, then it is known as alopecia totalis, and if there is hair loss in the entire body, then it is known as alopecia universalis. Alopecia totalis and alopecia universalis is a part of alopecia areata. What causes alopecia areata? Basically, alopecia areata is an autoimmune condition. What is autoimmune condition? Autoimmune condition is that your own immune system fights against your own body cells. In this case, your own immune system fights against the hair follicles, so there is hair loss. When you have alopecia areata and when you visit the doctor will also look for other associated conditions like thyroid problem, collagen vascular disease, Down syndromes and other causes which may lead to hair loss. Once that is ruled out and once it is confirmed that it is only alopecia areata and there are no other associated conditions, doctors will proceed on for treatment of your alopecia areata, which is the hair loss on the scalp. Normally the doctors will prescribe you topical application medications so that medicines can be applied or ointment or gel can be applied on the site of hair loss in alopecia areata. Doctors may also prescribe you oral medication to take, and in certain cases doctors also prescribe anti-inflammatory steroidal injections. These injections are injected intralesionally at the site of alopecia areata. So now you may ask me question, doctor, is this curable? Will I get back my hair which I had lost because of this condition? Yes, in majority of the cases, more than 90 to 99%, your hair will return on treatment in alopecia areata. Alopecia areata, your immune system do not completely destroy the hair follicles. Your immune system fights against the hair follicles, but the immune system do not completely destroy the hair follicles. So there are chances and there is good possibility that your hair will grow back and will return back to normal. And we also experience and see in many patients in which the alopecia areata is completely vanished off and your hair returns back on your scalp. I have this patient who visited me 4 months ago with alopecia areata. He had 3 lesions of alopecia areata, and when he was given the injectable steroidal medication and after 2 shots of these intralesional injectable steroidal medication, he got well and his hairs have grown back almost completely. And today he has come back to me asking, doctor, please inject one more time these intralesional injections. So I have decided to inject one more time as per his wish, as per his request. He is very much satisfied with the treatment because his bald head has now got back hair and he wishes that one last time this intralesional injection is injected into the site of alopecia areata. These injections we inject once in 4 to 6 weeks and call them and see how they are responding to these injections. I am throwing this drug into this syringe so that I will inject into the lesion of alopecia areata. As I had shown you the earlier pictures, 3-4 months ago he had 3 lesions of alopecia areata. One was here, the other was here, the other was here. So after injection of this anti-inflammatory and steroidal injection, his hair have come back significantly. Now almost like 100% it has come back. So he desires that one more injection is injected into these lesions so that he will have better hair on his head. Since now very little lesion has left, so it does not look like typical alopecia areata, but here was the lesion, here was the lesion, and here was the lesion. I am going to inject as per his request. I said to him that it's enough, no need to get further injection, but he requested me, that's why I am. It's so much nice. I'll just inject. This is an intralesional injection. When first time he came, it was totally loss of hair here. There was not a single strand of hair. The hairs have come back, grown back. I am just injecting, though I had told him that no need. He requested for one more time injection, so I am injecting. I think this is enough for this lesion. Just when we inject into the lesion, as we push the drug, there will be a bulge in the lesion. So let me try here. Here also almost the hair has come back, but just for one last moment I am injecting. I'll inject one here and one here. Normally you will see that the alopecia areata lesions are completely bereft of any hair. There will be no hair, it will totally bald. So his case was also like this. 3 months ago when he came, there was complete loss of hair in these 2 patches and one in the back of the head. So this doesn't look like typical alopecia areata now, because hairs have come back. It's almost like 99% hairs have come back. So whenever you have alopecia areata, please don't hesitate to visit the doctors. Please don't hesitate to meet the doctors and seek help. Many a times I have noticed that people having alopecia areata, they have different myths according to their local situation, according to their local traditions. And many of them do not turn up soon to see the doctor when they have hair loss. They turn up to see the doctor only when their neighbors, their friends and relatives start telling them, hey, your hair loss looks odd, your hair loss looks not good. Then only they come to see the doctor, many of the patients. Till then, they have different myths and different thought process regarding the occurrence of alopecia areata, and they remain at their home, and only when their neighbors or sometimes when the barbers tell them that you have this huge patch or multiple patches of hair loss which looks very odd. So whenever you have alopecia areata, please meet the doctor, please see a dermatologist, or please see a family medicine physician, so that they will help you to diagnose it, they will help you to treat the alopecia areata. And in alopecia areata, 90 to 99% of patients, they get their hair back completely. So it is a curable disease, so it is a curable hair loss condition. So please always take the help of the doctor to get treatment of the alopecia areata. So if you find this video useful to you, if you find this video of some word to you, please like this video. And if you want to get latest regular updates on health and health related issues in this channel, please remember to subscribe, and please remember to press the bell icon of this channel so that you will receive regular latest updates, videos on health and health related issues whenever I upload a new video. See you again in the next video. Till then, namaskar. Thank you.